My name is Tamia Oshie. I'm the Director for Community Health Improvement. Our impact goes beyond the four walls of our hospital because we're out in the community. We're meeting patients where they are. A lot of the community that we serve have not seen a healthcare provider in many, many years and have other determinants that prevent them from coming to the hospital. So our clinic is an opportunity for them to be able to have that access to care that they normally wouldn't have. The goal of community health is prevention, education, and empowerment. Our prevention comes during our screenings where we're doing blood pressure, cholesterol, A1C, glucose reading, and individuals and our patients understand what their test results are. The education piece then comes afterwards, where they understand what those results actually mean and what it means for them in terms of their health. Then the piece about empowerment really does come after the education. When our patients are educated, then they're more empowered about making right decisions about their health. They understand the importance of actually taking an active role in their own health and well-being. Trust is very important among the patients that we see because we see a specialized group of individuals who have been marginalized. And it's important that we build trust before we start treatment. And we do this through partnership. So we go in with a lot of our partners that are invested in those community members. But also there's a variety of diversity that's also within our team, within Luminis Health, where that representation matters. So when we do go out into the clinic, you're seeing people who look just like you and talk just like you. And it's very easy and accessible to trust them in terms of care. All our community health services are free to the community. Our screenings, our workshops, our health educational courses, you can visit our website.